Good morning, everyone, and welcome to the Alliance's webinar series. My name is Christine Beck, and I am the Organization Director for the Illinois Self-Advocacy Alliance, or we call ourselves the Alliance for short. Today's webinar, Hello, How May I Help You? How the Illinois Human Rights Authority can help you maintain your rights, will be presented by Seaman. He is from the Illinois Human Rights Authority. Today is Tuesday, May 14th, 2019. As a reminder, all attendees are in listen-only mode. If you wish to communicate with me or with Jean, please type in using your control panel and we will read your questions, comments, and contributions out loud. This webinar is being recorded and it will be posted on the Alliance's website so that you may view the recording 24/7. The Illinois Self-Advocacy Alliance is proud to be an initiative of the Illinois Council on Developmental Disabilities. Who we are. The Alliance is a great network of advocates, allies, and self-advocacy groups around Illinois. Our vision is for self-advocates to work together to get the support we need and to live the life we want in the community. Our mission is to speak up for ourselves and each other while working together to make changes in our communities and in Illinois. Our focus is on empowering people to speak up and speak out about what they want and need, what they don't want and don't need, to action plan their goals, and to participate in advocacy at the personal, agency, community, and statewide levels. We do this in a lot of different ways. We support local groups. We work together on important issues. We offer networking, advocacy, and learning opportunities through our monthly newsletters, webinars, our Ambassador Leadership Program, and the Training Institute. And this slide includes a picture of a white man with brown hair, wearing glasses, and a blue shirt and black pants, and he is holding papers. This slide has an outline of the state of Illinois with several stars on it, along with words. The Alliance is proud to have 26 member groups representing all parts of Illinois. Up north, we have member groups in McHenry and Zion, and also Dixon. Chicago and the surrounding areas are well represented with groups in Alsip, Brookfield, Chicago, Chicago Heights, and Homewood. We have member groups in Rock Island, Pontiac, Galesburg. We welcomed our newest member group, Friendship League, in Tremont. We also have member groups in Central Illinois in Bloomington, Beardstown, Jacksonville, Decatur, and Monticello. And towards the southern part of the state, we have member groups in Alton, Edwardsville, Charleston, and Paris. As I like to say, no matter where you live or where you work, there is probably a self-advocate or a self-advocacy group near you. And now I'd like you to meet the presenter. I'll let him introduce himself in a moment. There is a picture on the screen of a white man with short brown hair. He's wearing glasses. He also has on a gray shirt, and he has a mustache and a beard. So, Jean, take it away.
Hi, everybody. My name is Seaman, and I'm the HRA Managing Administrator for the Southern Region, which includes basically from Peoria down to the bottom of the state. And our agency is part of the Illinois Guardianship and Advocacy Commission. And I wanted to give, if we can go to the next slide, I wanted to give a overview of what we'll be talking about with this presentation. Mostly what we're going to cover is the Human Rights Authority, but I'll explain also about the Illinois Guardianship and Advocacy Commission, which is the state agency that the Human Rights Authority is part of. I'll describe the mission of the Human Rights Authority. I'll explain how the Human Rights Authority can assist you in retaining your rights. And then at the end, I'm going to give some examples of how the HRA has helped people. But what I want to start with is a little poll about rights. So I'm going to read these different situations, and what I want is to see if you think that these are rights violations or not. So I'm going to read the situation, give you some time to vote, and then I'll go over why these are or are not rights violations. So with this first one, it says, Jason receives special education services at his local high school. The school determined that Jason must graduate and leave the school at the age of 19, regardless of discussions and determinations made by Jason's team and written into his IEP, which stands for Individual Education Plan. So is this something that would be considered a rights violation?
All right, so this is your opportunity to speak up and speak out. And we ask you to do this by using your control panel and either pressing yes, that you believe this is a rights violation, or no, you do not believe it's a rights violation. So we'll let you have a couple more seconds to talk amongst yourselves, and then let us know what you think with this poll. Is this a rights violation? Almost everybody has voted. We'll keep it open a couple more seconds, and then we'll close the poll and you'll be able to see the response. All right, so for those of you who voted, 100% of you, or everyone, believe that yes, this is a rights violation.
Well, that's great because it is a rights violation. And the reason why this is a rights violation is because you can't, once you've made those determinations with the individual about the IEP with the team, you can't change those determinations as a school just, you know, because you want to or for whatever reason. You have to get together with the team to change any determinations or decisions that have been made by that team. So great job at 100%. We could go to the next one. And this one deals with community day services. So Barbara attends community day services and is having her personal cell phone taken away because the staff think that she is using the phone too much and not working or participating in classes. Staff only returns the phone to Barbara every 2 hours for 10 minutes. So would this be considered a rights violation?
All right, here's again another opportunity to speak up and speak out. Go ahead and let us know what you think. Yes, do you believe that this is a rights violation, or no, I don't believe it's a rights violation? So we are collecting responses now. We'll keep this open for another probably 10 seconds. So go ahead and speak up and speak out and vote. Let us know what you think. Is this a rights violation? So far, you guys are doing well. So I'm going to go ahead and close the poll. You'll be able to see the see the information. You should be able to see the poll results. 100% of you said yes, this is a rights violation.
Well, we have some really smart people listening because they're all correct with this. This is a rights violation. And the reason why it's a rights violation is because you should be able to communicate with people outside of the facility or services that you're using. So taking away the phone takes away that communication. So that is a rights violation. So great job on that one as well. And let's go to the next one. And this deals with CILAs, Community Integrated Living Arrangements. And the situation says Alex lives in a CILA, and Alex doesn't like or agree with the house rule about residents having their door open whenever they were alone in their room. After multiple complaints, Alex was told by staff that if he did not stop questioning the rule, he could find a new place to live. So would this be considered a rights violation?
All right, so we're going to go ahead and launch that poll. What do you think? Speak up and speak out. Do you think it's a rights violation? Yes or no? I don't think it's a rights violation. Let us know what you think. And we know there's lots of different ways to speak up and speak out. Sometimes we use it with our words, and right now we're using it with your votes, which I really think is neat. We'll leave it open just for a couple more seconds. Looks like everybody is voting. So we're going to go ahead and close, and the survey says 100% of you, all of you who voted said, yep, this is a human rights violation.
And again, everybody is correct. This is a human rights violation. And the reason that this is a human rights violation is on two different counts. One is a CILA should allow Alex to have a grievance against a facility rule, and they should go through the whole grievance process with them, which didn't occur here. And in fact, not only did it not occur, but staff said stop questioning the rule or he could find a new place to live, which is also retaliation. And staff are, which is the second rights violation. Staff isn't allowed to retaliate against people for stating their opinion about something. So great job. And we have one more, and this one deals with services at a psychiatric unit. And it says Sally is a patient in a psychiatric hospital unit. Sally has had staff force her to take medication, even though she tells them all the time that she doesn't want to take it, and it makes her sick. So is this a rights violation?
All right, another opportunity to speak up and speak out. What do you think? Is this a rights violation? Press yes if you think it is, or no if you don't think it is. And we are collecting responses. Leave it open for just a couple more seconds. Thank you everyone for speaking up and speaking out in this way. All right, we're going to go ahead and close it. We will share the results, and it looks like 100% of you said yes, this is a rights violation.
And 100% of you are correct. It is a rights violation. And the reason why is if you're receiving services in a hospital psychiatric unit, you can refuse treatment. They can't force you to take medication that you don't want. They can't force you to do treatments that you don't want. So this is definitely a rights violation. So great job on that one. And you can see it was a little bit of a trick because all 4 of them were rights violations, but wanted to get everybody's heads wrapped around what we're talking about when we say rights violations throughout the rest of the presentation. So it looks like there's one more opportunity for everybody to speak up and speak out. And the question is, have you heard of the Illinois Guardianship and Advocacy Commission?
All right, I just went ahead and put that poll up. Have you heard of the Illinois Guardianship and Advocacy Commission? And folks are voting. So yes, you've heard of it. No, you haven't. And actually, no matter what you pick, there's no wrong answer. There really isn't any wrong answer. For some of you, yep, you've heard of it. For others, no, this might be the first time, and we're glad if this is the first time you're hearing about it. All right, we're going to go ahead and close this poll, and I will share it. It looks like most of you have heard of the Illinois Guardianship and Advocacy Commission, and there's several of you who haven't, but now you have. And that's a good thing.
Well, so those of you that have heard about us, I'll try to give you some further information. And those of you that haven't, I'll just inform you about the Guardianship and Advocacy Commission. The Illinois, if we go to the next slide, the Illinois Guardianship and Advocacy Commission, and GAC is the shortened version that we usually use, was created in 1979 with the passage of the Guardianship and Advocacy Act. And the idea of the agency was to protect the rights of people with disabilities. And you can see that's our logo there at the bottom. If we go to the next slide, this has some more information about the GAC. We cover the entire state of Illinois. There are 9 primary offices located across the state, and the Guardianship and Advocacy Commission consists of 3 different programs. One is called the Office of State Guardian, and they're guardians of last resort for adults in Illinois. So if it's determined by the court that somebody needs a guardian, in the state of an adult needs a guardian in the state of Illinois, they may appoint somebody from the Office of State Guardian to be their guardian. The second office there is our Legal Advocacy Service, and they're our legal branch. And they deal a lot with mental health courts. So they do a lot of mental health commitments. They do mental health appeals. They basically represent people in mental health court, and most of the people on that staff are attorneys. And then there's the agency that I work for that we're going to discuss more length within this presentation, and that's the Human Rights Authority. And the Human Rights Authority is mandated to investigate complaints of rights violations against individuals with disabilities. And these violations are committed by disability providers. So if we go to the next slide, there's another map here, and it has a star. This is a map of Illinois, and it has a star for every location that we have an office. And all of those locations will have a representation from the Human Rights Authority at them. So we have 3 up in the Chicago region. One covers Chicago and Cook County. Then there's the northern suburbs, and then the southern suburbs. So those cover those regions. Then we have the Northwest HRA that covers Rockford. There's the Peoria HRA, which is where I'm speaking from today. There's the Springfield HRA in Springfield. East Central that's located in Champaign, and then we have 2 down south, Metro East, which is in Alton, Illinois, and the Egyptian HRA, which is in Anna, Illinois. So if we go to the next slide, that we do have one more question, and that is, have you heard of the Human Rights Authority?
All right, so before Jean was telling you about the Human Rights Authority, had you heard of it? This is our last poll, so go ahead and let us know. Had you heard of the Human Rights Authority? And again, there's no wrong answer for this one. We learn about information when we learn about it. And so looks like folks have voted. I'm going to go ahead and close that poll, share the results, and 100% of you have heard of the Human Rights Authority. So awesome. Words
Yeah,
getting
that's
out.
great. That's great, and I hope to give you some further information about us through the rest of this presentation. On the next slide, this is kind of the intro to the presentation, and it has the mission. And the mission of the HRA is to safeguard the rights of persons with disabilities under the Guardianship and Advocacy Act. And just like I said with the Guardianship and Advocacy, we cover the entire state of Illinois. And the HRA consists of 9 regional panels, which I'll get into what a regional panel is in the next slide. And the idea is to promote systemic improvement to disability rights protections. That's a mouthful. And the idea behind what we do is a complaint will come into the HRA, and then we look at that complaint and go to the facility and see if the facility is following the law that governs that specific facility. And if they're not following the law, we essentially ask them to change their policies and procedures and actions that they take so that they will start following the law. And in doing so, we protect those individuals that are receiving service at that facility. We protect their rights. And then something underlying that we try to do is make sure that those individuals are receiving services in the least restrictive environment. So what I think is the most special part of our agency is the regional panels. And the regional panels consist of a board of volunteers who make the decisions for all the complaints. They'll make the decisions on accepting, the findings within the complaints, the resolutions. They even go on the investigations with us. So we're different than other state agencies in the fact that other state agencies might go to a facility and say, we'll close you down, or we'll limit your admissions, or we'll limit your fundings if you don't make changes. What we have, even though we're a state agency, it's the people that work and pay taxes and live and possibly receive services in that community, going to these different facilities and saying, are you following the laws that govern the facility? And if not, you need to start doing so. So it's a true advocacy effort. So in doing so, we do investigations, and there's a little guy there with a mustache and a magnifying glass looking like he's looking for something. Doesn't exactly look like me, but he is doing some investigating, so this is a great slide. So what I'm going to do is talk about investigations, and every investigation starts with a complaint. A complaint of alleged violation can come to the authority from any source. It can come from a person with a disability, family members, service providers, facility staff, guardians, concerned citizens. They can be HRA initiated, which means the HRA could have seen something in the news or heard something secondhand and decide on their own that they want to open a complaint. And we could get complaints anonymously. We don't even need somebody's name. Just somebody could call up and say, this is happening at a facility. I'd like you to investigate. The example I always like to use with these investigations is we had a hospital call once, and they said, we're having a big problem with this family. We can't resolve their issue. They're not happy with what we're doing. So can we turn ourselves in? And they did, and we went and investigated, and it turned out the hospital needed to make some changes, and that helped out the family. So that kind of goes to this next slide. A complaint can be made by a letter, telephone, online at the GAC website. You can come in person to one of our board meetings. You can come to one of our offices and make a complaint. We don't have a specific way that you have to make a complaint. You don't have to call a specific phone number. You don't have to fill out a form. We'll take them any way you want to give them to us. The person making the complaint is mandated by the law that we keep that person's identity confidential. And the idea is that nobody will retaliate against them. So one of the downfalls, though, is for us to go and investigate something, we do need a release of information for the person receiving services so that we can look at their records. Now, with that, it does have somebody's name, but I always explain to the provider that doesn't necessarily mean that they're the person who made the complaint. It could have been anybody, and I refer back to that list on the previous slide and tell them all the different ways we can receive a complaint, and that usually works. And then the service recipient's identity is never in the report. In fact, we never even say the positions or titles for the different staff members, because you could look those up on the intranet later. So there's 3 criteria for opening a complaint, and I'll get into these later in the presentation, but the criteria is it must be a disability rights violation, must involve a person with a disability, and it must be done by a disability service provider. Some things we won't investigate are frivolous complaints, and that's something like if someone made a complaint and we went and investigated and had no findings, and then that same complaint was made over and over again, but we already knew that everything, that the facility was following the law, we wouldn't go and investigate that again. We wouldn't investigate complaints beyond the HRA's scope, and I get into that a little later. And then allegations of abuse and neglect. There's other agencies that investigate abuse and neglect, so we would never go in and say, this staff member punched this recipient or something like that. That's not what we look at. We look at rights violations. So we might look at safety of residents, we might look at training of staff, but we wouldn't look at abuse and neglect. Those are other agencies. So service providers that can be investigated, and the sentence there says any entity in whole or in part that provides services to eligible people. So we let the services drive what we're doing, and we can investigate hospitals, psychiatric units, special education programs, nursing homes, CILAs, vocational programs, community day services, and those are just examples. That's not an exhaustive list. And the HRA cannot investigate entities that aren't service providers like retail businesses, and they have clothing stores, restaurants, banks, movie theaters. Also, we wouldn't investigate police or any courtroom settings, as another couple of examples. So here's some examples of the issues the HRA would not investigate, and these go back to those 3 criteria. So we've had people call before and say they're not allowing me to smoke while I'm in the facility. That's not a disability rights violation. There's no right to smoke in any of the codes or regulations for a facility. Now, we might look and see if they're letting everybody else smoke except for one person, and then that might be an issue, but we wouldn't investigate the right to smoke in a facility. And the same goes for complaints about a given diagnosis and complaints about types of medications. We've had people call and say, I don't agree with my diagnosis. They need to change the diagnosis. Well, we're not physicians. We're not doctors, and we can't override doctors. And that goes the same with medication prescribed. People have called and said, I shouldn't be taking this medication. I should be taking this other one. We can't tell a doctor what medication to prescribe people. Now, we can say things like you have a right to put a note into your record, you have a right to be a part of treatment, but we can't change diagnosis or prescribe medication. And then we wouldn't look at complaints that are not disability related. An example of that is we had an individual call up and they had a complaint about their sinus surgery that they received. Well, that wasn't something that we could look at because it's not disability related. So how do we investigate? So we start with a site visit, and the board members go on that site visit, and it's a chance for us to talk to the administrators at the facility and anybody who's involved with that complaint. And the idea is to get their side of the story. So we ask them, you know, what happened here? What do you think happened? What caused this complaint? What caused this issue? Did it occur? And they get a chance to say what they think happened with it. And then also at that site visit, we can interview anybody who might have something to say about the issue. We can tour the facility, and we can talk to other people there that are receiving services and see what, you know, if they have any complaints that are similar. Then from there, we pull together the records. So if we have a release, we'll pull together the individual's records, and we'll pull together policies. And what we're going to do is review those records and policies and see if they're in compliance with the law for those facilities. So we have a complaint, we have what the facility said, and then we have the records and the policy. And we take all that and review it and write up what we've found into a report. So the report is called a report of findings. And if the report's accepted, it can be accepted with unsubstantiated findings or substantiated findings. And I get into what those mean in the next couple of slides. But then that report is sent to the service provider, and the service provider is mandated to respond to the HRA within 30 days of receiving that report. Now, if the report has unsubstantiated findings, that means that there just isn't enough evidence or information that somebody's rights have been violated. It doesn't necessarily mean that their rights weren't violated or that the HRA doesn't agree with their complaints, but it means that we have not found enough evidence to prove that rights have been violated. And then even if there's no findings, the HRA can still make suggestions and send those suggestions to the service provider. Now, with substantiated findings, that means the opposite. There is evidence or information that rights have been violated. And so from there, the provider must tell the HRA what they're going to do about the recommendations that are made. So they have to write up a response stating how they're going to change to comply with the laws and the regulations. And also in that response, the provider can tell the HRA if they don't think that the recommendations are right or fair, and they can disagree with us within that response. So once we receive the 30 days has come and we receive that provider's response, the authority can determine, they may determine that the rights violation and the issues have been resolved, depending on what the response says. If the facility made all the changes that we requested, then the board will probably vote on that everything's been taken care of and close the case. So they would close the case and make it part of the public record, which means anybody can get a copy of that report at that point. And then a copy of the report will be put up on our website, and then a copy of the report is sent to the complainant. Now, the HRA may also decide that the response doesn't show that the violation has been taken care of, and we go into what's called a negotiation phase. So we just say to the facility, you know, you still need to do some work on resolving these issues, and we can go back and forth with the facility and try to figure out a way to resolve what's going on. Now, the HRA is not what's called an enforcement agency, which means we can't force the facility to make the changes in the report. So what we can do if the facility says, no, we're not going to make any changes or doesn't respond to us, we can send a copy of our findings to the agency that would make the changes, and ask them to look at the report and make the changes for us. And if the agency doesn't cooperate, that usually takes care of it. I do want to say we do have a high rate of cooperation over the last few years. It always falls between 90 and 95% of the time. The facility will make the changes to the and follow the recommendations that we put in there. So that's how the HRA works. And what I wanted to do from here is give you some more examples of rights violations, kind of like the ones we started with at the beginning of the presentation. And then I wanted to give you a couple of scenarios of actual situations that the HRA was in, what we did, and then the outcomes of those scenarios, and then leave you some time to ask questions and that at the end of the presentation. So this first set, these are actual rights that you have at these facilities. And this, we start with CILAs, which are the community integrated living arrangements. And this is the rights violation, and also what's those numbers afterwards, the actual code of the law. So the actual citation of the law where you can find these. And these are paraphrased, so it isn't exactly how they're written, but the idea behind the rights that you receive. So this first one says your written rights will be provided to you in a language that you understand. So a CILA must give you your rights if you speak in whatever language that you speak or most comfortable in, or if you don't understand what they have, they have to provide them to you in a way that you understand them. Then, like I said in the first one, you're able to present grievances. So if you disagree with something at the CILA, you have to be able to start a grievance with them and have that looked at. This one's important. You can only terminate services if on these different conditions: if the home cannot meet your medical needs, if your behavior puts you or others at risk for danger, if you want to transfer to a different facility, or you no longer need CILA services and you want to move to someplace else. So those are the only times they can terminate the services. Then this next one says direct care employees must show they know all the areas of training, and that includes behavior management, abuse, neglect, and unusual incident prevention and handling, and reporting, and individual rights. Basically, what that's saying is the direct care staff must be trained, and they must be trained in those areas. So this next slide, we're still dealing with CILAs, but these are rights concerning money. And these all come from that citation at the bottom, that 210 Illinois 135 9.1. So it says the CILA should keep a written record of all money spent involving residents, and access of that record needs to go to the individual and guardian. So they have to be completely transparent with your money. The CILA should provide a written statement of all money spent involving the resident's funds, or a copy of the resident's checking or savings account for the period quarterly. So not only do they have to be completely transparent, but they have to send something quarterly. Then the CILA should deposit any funds over $100 into an interest-bearing account. So just like anyone who has a bank account, you should be able to receive interest on the money if it's over $100. And then the CILA should keep money from the resident in an account separate from theirs. And that's so they don't accidentally spend your money instead of in instances where theirs should be used. So this one deals with psychiatric services. And this first one reads, when you receive services, you should be provided with adequate and humane care in the least restrictive environment, and they need to follow your service plan. And then the recipient can partake in the plan, as well as the guardian or anybody else that the recipient wants, as long as it's in writing. So you have to have a plan, and you can have your guardian or whoever you want participate in that plan as well as yourself. When receiving services, you can have private, uncensored, and unimpeded communication with whoever you want, and you can communicate by mail, telephone, or visiting. So you have to be able to communicate with somebody outside of the psychiatric facility. They have to allow that. Here's another psychiatric service one. The facility has to tell you if you are receiving services that you can refuse the treatment and services that they want to provide. So that kind of goes back to what we talked about at the beginning of the presentation. And then if someone ever restricts your rights, they have to provide you with a notice that explain why the rights were restricted, and your guardian needs a copy of this notification as well. So they can't just restrict your rights without letting you know why. So here's some with community day services. You or your guardian can appeal decisions that say you cannot receive services from the provider. You can appeal decisions that change services. You can appeal decisions that give you less services or that stop giving you services. So there's a whole appeal processes regarding your services at community day services. Your records should be private, but you or your guardian should be able to see your record. They have to keep your record confidential unless you or your guardian want to read it. Then if you're unable to read, your rights will be explained to you in a language that you can understand. So much like the psychiatric service or the CILA services, they have to give you your rights in a way that you understand them. Here's some rights when receiving special education services. So if a student is suspended for more than 10 days, the IEP team must meet to determine if the student's disability is the main cause for the incident that caused the suspension. So you cannot be suspended for something related to the disability diagnosis. A copy of procedural safeguards must be provided to a parent when requested, and that's kind of the different steps that they can take to appeal, or if they don't like a decision. And it's basically like receiving your rights when you start at a new facility. And then a school district must provide a parent a written notice to the IEP meeting no later than 10 days before the meeting. And that's to assure that the parent has time to go to the meeting and is aware of it, and that they participate. So what I want to end here with is just a couple of actual examples of complaints that we've had and that we've investigated and finished, and what we did. And these are both on our website. They're in report form if you ever want to go read them. And so this complaint is an ADA related complaint, and the complaint states that an individual using a wheelchair attempted to board a bus and was not allowed on. The complainant stated that the individual was told by the bus driver that the bus lift did not work. The complaint states that the lift did work, but the bus driver just did not want to manually open the lift so that the rider could get onto the bus. The bus rider using the wheelchair reportedly has to go to the bus barn to be able to ride an accessible bus, and the complaint states that this happened 2 to 3 times a week over the last 4 years. So in this next slide, it's the first, we did our research, and it's the first regulation that we found. And this basically says that public accommodations have to have equipment that makes things accessible and usable by persons with disabilities. And then on the next slide, this is kind of a more specific federal regulation, and this says that vehicles have to have a lift or some sort of level change mechanism, a way that somebody using a wheelchair can board a bus. And then not only do they have to have that, but it has to have clearances so that the wheelchair can move around and be able to be secured. And you see there is a picture of a bus with a lift on it. So what we ended up finding with that is we couldn't determine for sure that the bus driver wasn't doing the lift, or because we didn't have a name, we didn't have a bus number or anything like that. But what we did find out was that buses can drive a route with a broken lift, but only for a certain short amount of time. And then after that time is up, they have to have that bus not go out anymore. And this specific bus company was not keeping track of how long buses were going out with broken lifts. So we substantiated based on that and had findings, and then the bus company made the changes and started keeping track of how long the buses were going out with lifts and fixing them more regularly. So if we go to the next slide, this is another example of a situation. This dealt with a skilled nursing facility. The guardian of a person who lived at a skilled nursing facility requested that the person receive milkshakes or chocolate milk at lunch. And that is because the person hadn't been eating and was losing some weight. They needed some calories. The complaint states that the skilled nursing facility said they only serve milk at breakfast and dinner to save money. The skilled nursing facility did give the person milkshakes, end up giving the person milkshakes or chocolate milk at lunch, but didn't give it to other people. So if we go to the next slide, the regs that we looked at basically said that people have to have a care plan, and in that care plan there needs to be objectives, and it has to deal with medical needs and nursing needs. and it has to be based on assessments, and it has to allow my part that I really focus on here, maintain the highest practical level of independent functioning, and it has to have a discharge plan, and the guardian and recipient have to participate in that plan. So you have to have an individualized plan at skilled nursing facility. And then on the next slide, we found some federal regs that state that facility must care for people that in a way that promotes maintenance or enhancement of quality of life. Recipients must choose activities. They have to have self-determination and participation. Those activities have to deal with what they want to do. And then they have to make choices about their life. So we took both of those regs and said you can't have an overall policy that says nobody can get chocolate milk because of money. It depends on the individual and what they want because they're living at that facility. And we sent that in a report to the facility, and they made the changes and got rid of the rule that banned chocolate milk and milkshakes for individuals at the facility. So that concludes my presentation about the HRA. I wanted to end with showing you some different ways you can contact us. There's a toll-free intake phone number there. And then there's the number to all the individual offices and also our toll-free TTY line. So if you have a complaint, you could call that intake or you could call the individual offices. And then also we have the website. You can come to the website and there's a complaint form on there. And also it has all the meetings, so you could come to the meetings and have a complaint. The website also explains about the agency and stuff if you're interested, and it has all the reports and everything as well if you want to check those out. And then we also have a Facebook page, and we'll even take complaints on that if you want to. I encourage you to like it, and it'll give information about where we're going to be speaking and places that we're going to, you know, with info fairs, and then, you know, sometimes little tidbits dealing with advocacy. And so are there, oh, go ahead.
No, that's okay. We've come to the time where we are open for questions, comments, and contributions. So if you have a question, a comment, or contribution for Jean and for this presentation, use your control panel, type it in. We want to know what you think. As people are thinking and typing in, Jean, for allies. So an ally can be a family member or a support staff, a professional. What can an ally do to help support the human rights of folks?
Well, if they you know, they can help and assist in the advocacy at any level. You know, at the facility, they can assist with the advocacy by looking at the grievance processes and making sure that there's appeal processes, making sure that those rights are being explained to everybody, and just making sure that the facility knows that you're aware that you do have rights. Then also they could contact us if there's an issue and they feel like it needs to go to that next level and have some investigation done. And then we could go from there. It doesn't have to be the person, the actual person receiving services making the complaint. An ally could also make the complaint with the HRA.
All right, awesome. So for those of you who are listening, who are allies, one of the best first things that you can do is to help people understand their rights and in a way that they can understand. And the Illinois Self-Advocacy Alliance does have a resource to help you with that. It is located on our website under resources, and it's called It's My Right. And it explains the rights of people who are receiving services in Illinois, not only the right, but then explains it in an easier to understand way, as well as using pictures, because we know that people learn lots of different ways. So I'm not seeing anybody as having a question, comment, or contribution at this point. So I just want to share our closing slide before I ask Jean to see us out. If you would like to contact the Alliance, you can reach us at info@selfadvocacyalliance.org. Our website can be found at selfadvocacyalliance.org. And like the Human Rights Authority, we also have a Facebook page. You can find us and like us at Illinois Self-Advocacy Alliance. And this slide includes a picture of a white person with brown short hair. The person has his right hand in the air and is making a fist. The person is wearing a purple shirt with white letters that spell out, "Ask me about the Alliance." And Jean, I'll let you have the final words as we close out our time together today.
Sure. I just want to thank everybody for listening and participating. And I also wanted to mention our agency does also just answer questions. So if you ever have any questions about your rights or anything like that, feel free to call one of those numbers at your local office, or call the intake office, or you can even get a hold of us on the website or Facebook and ask any questions that you may have, and we'll get back to you and answer and try to help you out. It doesn't mean that you have to we have to do an investigation if you just want to ask questions. So thanks a lot, and thanks to the Alliance for having me. I appreciate the opportunity to talk to everybody, and it's been really fun.
All right. So on behalf of self-advocates, allies, self-advocacy groups in Illinois, we thank you for your time today. Goodbye, everyone.